A game changer is literally something that alters the way we do things. And we don't have a lot of game changers that come along every day in medicine. We constantly are trying to do things in a better way and in a more efficient way. I like to use the word game changer with this because it is fulfilling a huge void for women. This is almost immediate. As part of the protocol, we had patients, we would see them 1 week after their first treatment. And hands down, there was improved moisture, less pain, less pressure. This is very exciting to me as a researcher because I think this is just the tip of the iceberg. This area of vaginal and vulvar atrophy, which basically means the vaginal tissues become dry, they become very sensitive, is a huge problem. There's really not a lot of epidemiologic data, but millions and millions of women suffer from this. And unfortunately, most of them suffer in silence. So this is a very, very needed therapy. I was very willing to try this because it's a huge need. It's a huge therapeutic area. The other big group of women that are truly suffering in silence that can't even take the medicines are breast cancer survivors. I can just tell you that I am blown away with how well it works. The therapy takes somewhere in the range of 3 to 4 minutes to deliver. It doesn't require any anesthesia, no creams, no Valium before, nothing. There was not one patient that could not tolerate it. It's a probe that goes into the vaginal canal, and then you deliver the laser therapy. There's no pain with the laser therapy. Sometimes putting the probe in on that first therapy just because their vaginas are tight and sensitive is a little bit painful. But again, we did not have one patient that couldn't tolerate the therapy. Hands down, 100% of the patients have had improvement. It penetrates the wall of the vagina and stimulates cells that are important in creating fluid, improving collagen synthesis. It's a very, very scientifically validated mechanism of the way it works. So this is real, this is legitimate, and I'm very excited about it. This isn't about enhancing sex. This is about treating a medical condition that basically occurs in almost every woman that goes through menopause. So you would want to make sure that they're not being pulled into something that hasn't gone through the scientific validity and the due diligence required. I would say that if you've got these symptoms and you can get to a physician that is able to deliver this MonaLisa Touch therapy to you, you know, not too many things you can say there's no downside to it. I really don't see any downside and a tremendous potential upside.
Hello, I'm Dr. Stephen Rabin. I'm a board-certified gynecologist here in Burbank, California, and today I'm going to answer the 3 top questions that we're getting from doctors and patients about the MonaLisa Touch procedure. So first of all, what is the MonaLisa Touch procedure? This is a revolutionary procedure that's designed to treat vaginal atrophy. Now, this is a condition that occurs in over 40% of all postmenopausal women. It can cause pain and itching, burning, dryness, and difficulty or pain having sex. Vaginal atrophy is a big problem, but so many women are not coming forward to discuss this with their doctors, and doctors haven't had a whole lot of effective treatments for this until now. The MonaLisa Touch procedure is a fractional CO2 laser. This is the same kind of laser treatment that's been used for decades to help with the aging of skin in other parts of the body. But this one's performed intravaginally, and it has stunning results. It's done in the office in a matter of 5 minutes. 3 treatments, 4 to 6 weeks apart, is all it takes. So question number 2, naturally, that sounds painful. Well, it turns out that the MonaLisa Touch procedure is virtually painless. With rare exception, all I've heard my patients say is that they can actually feel the machine itself vibrating. The actual treatment has not caused them any pain or discomfort. This does not require any pain medication, numbing creams, anesthesia, no painkillers at all. This is done in the office in a matter of 5 minutes, virtually painless, with stunning results. So that brings us to the third question. What kind of results can you expect? The MonaLisa Touch procedure restores the vaginal elasticity, moisture, and thickness to the skin. We're able to measure this through the vaginal pH, through measurements of how well the vagina tolerates dilation, and just the patient herself saying that she feels like herself again. The short-term results are, again, stunning. Within 3 to 9 days, patients are feeling 50, 60, 70% better. After the second and third treatment, 90 to 100% better, and this result lasts for at least a year. And what we're seeing is that patients will come back for a once-a-year treatment for maintenance. Just think of it like your annual exam, and it should be just as easy. The MonaLisa Touch procedure is now available.
I was diagnosed with breast cancer at 29. I had gone through 2 surgeries, radiation, was put on tamoxifen, and started experiencing all of the side effects of tamoxifen, which included vaginal dryness and atrophy.
Hot flashes and dryness and painful intercourse.
I was having a lot of pain with intercourse to the point where I just stopped being sexually active.
We were having no sex at all, none. And, it really was detrimental to the relationship because, here you have your partner who is looking at you like, what is wrong with you, or what is wrong with us? Is there a problem with, are you not attracted to me anymore? It's really hard not to be able to have, sex with the person that you love.
I tried multiple things. I did the patch, I did creams, I did oral medication, and I just stopped doing it because of all the controversy.
This treatment is life-changing. It is something that you can do without feeling scared that it's going to make your breast cancer come back or cause other health side effects.
And there's no drugs involved, so you don't have to be worried.
There's no pain, no discomfort, and I definitely saw results pretty much immediately.
The treatment itself is totally painless. It just feels like a little bit of a vibration. After that first treatment, I had results almost immediately. I mean, within a few days, I could tell that things were functioning more as they should be.
Well, I would say I'm 90% better.
My message will be definitely try the MonaLisa. It's worked for me.
I would recommend it to any woman who had any kind of concerns about vaginal dryness or atrophy.
The improved intimacy definitely impacts a lot of aspects of my life. I'm happier, he's happier.
I mean, I would say go for this because this will fix it.
MonaLisa Touch è una grande
MonaLisa Touch is the great innovation from DECA. MonaLisa Touch fights the negative effects of vaginal atrophy during menopause using Smart Excite Square, a special laser that, thanks to a special DECA pulse, can reverse the biological clock of the vaginal tissue.
L'orologio biologico del tessuto vaginale. Per dimostrare l'efficacia della
To demonstrate its effectiveness, we have turned to a scientific committee made up of representatives from the best Italian universities and research institutes.
italiano.
L'esperienza dermatologica in campo laser terapico
The
maturata
experience in laser therapy that we gained through the collaboration between DECA and a number of experts in the field sparked scientific interest towards a new therapeutic application. A new CO2 laser system was devised with a pulse mode created specifically for the treatment of the vaginal mucosa. This new method is known as MonaLisa Touch.
analogamente a quanto accade in ambito
Just like our skin, the vaginal mucosa undergoes morphological and macro and microscopical functional changes over time, which leads to atrophy and related symptoms.
dell'atrofia e i sintomi ad essa correlati.
Spesso i sintomi di atrofia vaginale
The vaginal atrophy symptoms include dryness, burning sensation, soreness, and pain during sexual intercourse, and they are often mistakenly considered as an avoidable consequence of aging.
il trattamento viene eseguito.
This treatment is carried out by means of vaginal applicator, which spreads the laser energy along the whole vaginal tract. It's an absolutely minimal invasive procedure that is carried out in the doctor's office without any need of anesthetics or analgesics. Significant improvements of the vaginal atrophy symptoms are seen just after 1 month, which in turn means a positive effect on the quality of life.
Positivo sulla qualità di vita.
%40 of women suffer from vaginal atrophy during menopause, but only 25% of these tell their doctor spontaneously.
Ciò che mi ha convinto definitivamente era che
What convinced me was the fact that I read on the web that MonaLisa Touch is totally painless.
assolutamente indolore. Il trattamento è stato eseguito
The treatment was done in my gynecologist's office without anesthesia. It lasted only a few minutes, just like a pap test.
minuti e praticamente come eseguire un pap test.
Questo trattamento laser
This laser treatment regenerates the extracellular matrix of the vaginal mucosa with a new synthesis of collagen, fibrillary components, and ground matrix constituents. It guarantees turgidity of the mucosa and favors the transportation of metabolites and nutrients towards the epithelium, which in turn thickens and produces glycogen that accumulates in cells and is set free by physiological desquamation. This favors the return to a normal vaginal pH. The treatment with MonaLisa Touch rejuvenates the mucosa, which is restored to its pre-menopause condition, just as after an estrogen treatment.
ormonale estrogenico.
Dopo il trattamento mi sembra essere tornata indietro.
I felt 15 years younger after the treatment. No more dryness, pain, or burning sensations. I can't believe it. Just like a dream.
DECA è una società nata
DECA was founded 30 years ago for the production and commercialization of medical laser systems. We operate in sectors such as dermatology, ENT, gynecology, dentistry, and urology. You can find us in over 60 countries around the world, as we have distributors and branches in countries such as France, Germany, the United States, and Japan. MonaLisa Touch is an example of DECA's continuous innovation in gynecology. We have also used one of our internal laboratories to give scientific demonstration of the results we were aiming at.
dei risultati a cui volevamo pervenire.
This morning we're talking about critical women's health issues and some game-changing treatments that could mean a whole new world for cancer survivors, those who have undergone menopause. We're talking to urogynecologist Mickey Karam and his patient Lisa Elliott. Good morning to you, and thank you so much for joining us.
Good morning.
Good morning.
Thanks for having us.
Of course. Now, you know, we're talking about a lot of women who suffer in silence. Of about the 46 million women who are over 50, there are 2.8 million who are breast cancer survivors. And Dr. Karam, if you could tell us the unique situation that often triggers where you can help.
Sure. So women that go through menopause basically lose their circulating estrogen. And in a matter of a year to 3 or 4 years, with the loss of that estrogen, the vaginal skin and the vaginal tissue takes a significant toll. And it basically dries up, and that's the term that we use in medicine called vaginal atrophy. And when that occurs, women start to have vaginal dryness, burning, a lot of pain with intercourse, irritative symptoms of the bladder like urgency and frequency. And this truly does impact millions of postmenopausal women, but also, unfortunately, it impacts most breast cancer survivors, because women that have breast cancer, either their breast cancer could be an estrogen-dependent cancer, so they can't take estrogen, or many times they're on a medicine that's an anti-estrogen and basically antagonizes the effects of the normal circulating estrogen.
Now,
so
Doctor,
that's another big group.
You have come up with a solution that is relatively painless, really a game changer when it comes to this. Can you tell us a little bit more? Describe the procedure, the MonaLisa Touch.
Sure. Let me just be clear. This is nothing that I came up with. This is technology that's coming to us from Italy. It's been utilized worldwide on 15 to 20,000 women. Fortunately, I was the first clinician in the United States to utilize and study this treatment. It's basically, the MonaLisa Touch is basically a minimally invasive therapeutic laser treatment that literally takes 3 to 5 minutes to administer. It's an office procedure. There's no pain, there's no anesthesia required, no downtime. We did the first trial, and one of my patients that was in the trial is here with me today, and that's Lisa, and she's a breast cancer survivor.
And Lisa,
she went through the treatment, and she can talk to you about that.
Lisa, and your story is so compelling because you went through this so young, in your early 30s. Tell us about that.
Yeah, actually, I was diagnosed with breast cancer when I was 29, went through the treatments, and have since been on tamoxifen, which, as Dr. Karam mentioned, is an anti-estrogen. It basically takes the estrogen from your body, or stops the estrogen in your body. That being said, I went into sort of a post-menopause-like state and had tremendous vaginal atrophy. It was extremely painful, but because of my history of breast cancer, I was unable to take any of the available treatments that are on the market right now, or that have been on the market, because they are all hormone-based. And whether that is systemic estrogen or localized estrogen therapy, none of those worked for me because of my breast cancer status. So this is the first treatment that is available to women like me, or women who are not interested in taking hormones, that is safe, it's effective, and I will tell you, I had phenomenal results out of this, and I'm just so pleased. I'm so happy to share this with other women who, you know, they can stop suffering.
And you had experienced physical discomfort, and after these 3 treatments?
After these 3 treatments, that went away, and I really felt like I did before cancer. I felt like I did before all of menopause symptoms. I felt like I did in my early 20s, like I'm supposed to. And the treatment, it was probably about 2 days after the first treatment when I started noticing the effects, and I was shocked. I was sort of in disbelief myself, because I didn't think that any treatment could be that effective that quickly. But I started noticing changes right away, and that just improved tremendously over time. And by the end of the 3rd treatment, I honestly feel like I had just been cured.
Dr. Karam, in our last 20 seconds, if you could tell people who would be interested in this MonaLisa Touch therapy, how much does it run, and is it covered by insurance?
So it's not covered by insurance, and currently, depending on where you get it done, the range is about $600 to $900 a treatment. The therapy requires 3 treatments, 6 weeks apart, and there's about 50 or 55 sites in the United States that, where it's currently available. You can go to smilemonalisa.com, and those sites are listed on that website.
Well, we certainly do appreciate you letting us know about this revolutionary treatment for women in need. Thank you so much for your time. We certainly do appreciate it.
We all want to look and feel younger, but that pursuit for the fountain of youth, it's not limited just to the outside of our bodies. Check it out.
So I'm here in Dr. Weiss's office. I've been struggling with stress urinary incontinence and vaginal dryness, vaginal irritation, urinary frequency and urgency, and I'm done with it. I'm over it. And I'm so excited about this new procedure that can help me. And I was also told that it helps tighten things up a little bit too. Hi!
All right, Jen, you ready to do this?
You're my favorite guy.
Don't be nervous.
I'm nervous.
I watched a YouTube on how to do it, so we're okay. So what the MonaLisa does is a CO2 fractionated laser treats women who have atrophic vaginitis, so in menopause, the thinning out the dryness of the cells.
I'm not in menopause yet.
Right.
Just to be clear.
Yeah. So what we're finding now, it does increase blood flow. There's angiogenesis. New blood flow grows into the tissue.
Really? So it'll be juicier and youthful and...
You explain it so much better than I do. All right, I'm going to get you set up.
Okay.
And we'll go do our laser. This is the probe. It has markers along the side of each centimeter. We put the probe in and it shoots the laser. We can't use any lubricant when we put the probe in because it's a CO2 laser and it has what we call affinity, as you know, to water. So we're going to put the probe in.
You have to relax.
You're done.
Oh my gosh, I survived.
You did great. You did great.
From that procedure with Dr. Berman, Dr. Peter Weiss joins us. When you do a procedure like this, what are the main things you're looking to improve or treat?
A great question, and that's a really important thing. So it's a beautiful video, it makes fun, and it makes light of a real medical condition. So when we talk about menopause, in men we have so many other avenues that we can deal for sexual function. Women who go into menopause, and this was really geared back in Italy about 3-4 years ago for women who've had breast cancer who could not take estrogen. So the woman's vagina becomes very thin in menopause, or if you have breast cancer, you can't take estrogen to treat it. So the laser stimulates, goes down into the real meat of the area where it'll have new cells grow, new blood flow. Really what the MonaLisa Touch laser is, a CO2 fractional laser. And
right, which I use on the face
all the time.
Yes.
This is a specific type of probe that's FDA approved for the vaginal tissue. It's something called the decapulse. I can go all the science, but it's really geared to reinvigorate and stimulate the growth of healthy tissue in women, primarily who've gone into menopause, who have the thinning of the tissue, becomes pain with intercourse. That's where it works. And in my practice, we're finding about 90% improvement with it.
And obviously, Dr. Berman, you have access to a lot of therapies, technologies, Dr. Weiss. So as far as anyone watching at home, how much does it cost as far as...
Another very good question. So when women go into menopause, after about 4 years of menopause, about 60% of women will have complaints such as this with the dry vaginal tissue, pain with intercourse, bladder function, things like that. So it really does affect a great number of women just going through menopause itself, and then you have other women who have issues from breast cancer and
so
other bladder issues. The cost varies. Insurance doesn't cover it. It depends on what. Well, it may or may not, but bottom line is between $500 to $1,000 a treatment. You need 3 treatments, 6 weeks apart, and then you get 1 year's. And then you're fine. And then every year you do a maintenance. So that's really what it really gears. And we have phenomenal response.
You want to know how I'm doing?
Just a couple days, how are you doing?
Well, I do notice more vaginal, I mean, not to be lewd, but more youthful, like when I was younger, kind of secretions going on.
That's a very common response. And what happens, like you know from when you do the CO2 laser of the face, the cells start to grow. So you see a response within about 2 weeks. And that's for the initial treatment. And the reason you do 3 treatments is because the cells will start to sort of die off again. So once you do those 3 treatments, you get about a 1 year.
But I'm having actually no frequency and urgency. I will say, frequency, which I have all the time, frequency urgency is gone, 0.
Wow.
I don't think I've even gone to bed.
Well, and what is so great about this technology, and lasers are improving, it seems weekly, is so many more options for, you don't like the word rejuvenation, but it's non-surgical, and so it's so much more benign in terms of some of the other things that may have to be done. So I think this is a great option, and Dr. Weiss, thanks so much for sharing this technology with us.